good afternoon, good evening, wherever you are in the world. My name is Katy Stevens. I'm the clinical nurse advisor for Sigvaris Britain, and welcome to the Sigvaris Medical Online Hub. We've got such an exciting session today, and we've got Becky Elwell moderating the session. So I'm just going to hand over to her to introduce the session that we have today and the speakers. Becky, over to you, please.
Katy, thank you for organising such an amazing event and for allowing us to be with you today. I'm delighted to be with two people I consider to be friends as well as colleagues. So we're going to have a lot of fun. It's also Thursday of Legs Matter Week, which has been the biggest buzz ever. I hope you're all enjoying your events and activities, and please do join in with posting on your social media channels your one thing that you wish that everyone understood about legs and feet. So this session today is really super innovative because we know that this is an area where there is very little chatter going on out there about it, very little up till now research, and also something that we find it difficult to recruit people to talk about this in this particular group, and that's about men's perception of living with lymphedema, their experiences, their feelings, their thoughts. And I'm delighted to introduce Dr. Gary Cooper. And Gary is a lymphedema clinical nurse specialist of many years now. I hate to say that because he looks so young. And he's also an award-winning Queen's nurse for his contributions in primary care. And Gary, I think it's fair to say that you've dedicated a large part of your working life to further investigating and researching this exact topic that we're talking about today. Gary's also a member of the British Lymphology Society's scientific committee, and I'm a trustee, so we're delighted to also represent BLS today. So without further ado, I will let Gary begin his presentation before I have the pleasure of introducing Matt to you.
Brilliant. Thank you, Becky, for such a warm welcome. And thank you to everybody joining us today to talk about this important topic around men with lymphedema, their experiences, and to talk through my particular PhD. Now, Katy's going to share my slides on my behalf. Hopefully they've appeared. There we go. Thank you, Katy. Brilliant. So with this side of things, my PhD research was over 4 years, and I had 4 different pieces of research that formed it. I'm going to talk about the latter 2, which is about my diaries that men completed and also the interviews that men also completed alongside it. The diaries themselves focused on their daily lives, support and masculinity through the solicited diaries and semi-structured interviews. I'm Dr. Gary Cooper, and I'd like to acknowledge my supervisors, Professor Nicola Gale, Dr. Mambinder Sidhu, and Professor Kerry Allen at the University of Birmingham, who supported me during this actual journey. Katy, next slide, please. So the reason for a lot of this, if we talk about the broader background around men's health inequalities, men themselves face major health inequalities with usually shorter life expectancies than women. Also alongside that, there are greater risk of cardiovascular disease, early death as an example, more alcohol intake and substance misuse compared to women. Also, they're usually associated with seeking help in lower levels compared to women. And that's both for their physical and mental health issues. But what we also realise is that there are different factors that come to play that leads into the health inequalities that we see. Those are the underlying factors. So such as gender, class, ethnicity contribute to these disparities that we do see. Also equally, different people have investigated this, and some of this has been around the psychological aspects about masculinity through the notion of precarious manhood, which explains in certain degrees around how hard it is for men to reach a certain level in terms of their manhood and masculinity, but it's so easily taken away. And this might explain some of the reasons as to why men don't seek help, because it might be perceived as weakness. Katy, next slide, please. But when we look about the gap between men in lymphedema to women, what we find is certain cases of studies have said that actually 2.48 per 1,000 of a population are men affected by lymphedema, compared to 5.37. If we look at the UK caseloads, it's around about 15 to 22% are men. Now, this may be an underestimation, especially if men aren't reaching out. And also equally, we've had previous research about cancer with men, but when it comes to non-cancer, that's been under-researched. And with this side of things, there are different factors that come to play that represent both genders when we speak about their own experiences. Next slide, please. So my study design that featured my PhD is I did a systematic review at the beginning. Those people unfamiliar with it, that systematic review, like most studies, kind of gives the background, the landscape, and identifies the gap. And some of the gap that I was identified there was not having studies focused solely on men, let alone men without lymphedema, which was my study. That fed into an online survey which 22 men participated in, and that focused about self-care. And then those 22 men came forward into the 12 men that were featured in our solicited diaries that documented their daily experiences. Now, their daily experiences could have been every day, it could be in alternate days, or weekly summaries that came to play. What was fundamentally important about that diary was something occurred that made them want to write about it, and that's what I was interested in. That then fed into the semi-structured interviews. So those 12 men that did the diaries came into the semi-structured interviews, and we did that online. Now, this formed part, as I say, that 4.5-year research that I did that began in September of 2029. And all of this had full ethical approval from the University of Birmingham. Next slide, please. So the overarching research question that I asked in my PhD is, what are the men's perceptions of non-cancer related lymphedema? That then broke down into smaller questions. So the diary focus was how do men perceive lymphedema within their daily lives? And then the interviews focus on what are the perceptions of support and masculinity with lymphedema. Next slide, please. So there are different ways of looking at masculinity, and these are some of the conceptual frameworks that come into play. On the right-hand side is about hegemonic masculinity, which is about the most honoured way of being a man that few men actually meet. This is almost the notion of having an idealised version in society of what men should be or could be. Now, with that, we know that men are not just one group by themselves. They're a group within a group that then differ in different ways. And that's why we also have at the bottom right-hand side about multiple masculinities. They talk about inclusive, hybrid, caring masculinities, and other things in between. For my research, I use hegemonic and HIM framework. And the HIM framework speaks about the health, illness, men and masculinities, views of masculinity as a social determinant, the underlying factors that came to play. And they also speak about the life course in terms of men and masculinity at the bottom, about how that changes over the life of men. From younger adulthood, of potentially being more risky in activities, to then later life of trying to earn more, produce capital and provide, and then latter years whereby, unfortunately, like as we age, may be becoming more invisible, socially isolated and withdrawn. Next slide, please. So I did a qualitative approach across my PhD, and this was a narrative inquiry because what I was interested in were the stories that men told me and when they wrote it or spoke about their world that they live in. And within that, I did multiple different ways of analysing that. So this is narrative analysis, either looking at structural, the form, so the diary, the form in which they write, thematic, the content that came to play and the categorisation, let alone when it came to the interviews, the linguistic nature, what men actually said. And sometimes what actually men said may have differed in terms of the emphasis on certain words or terms. And that made this a really interesting piece to begin with a survey, go to the diary, let alone to the interviews. It's a wonderful way of helped me to enrich my understanding around this subject area. Next slide, please. So when it came to the diary, the main theme that came through about their daily lives was about the vulnerability they perceived. And some of that vulnerability spoke about the limited medical understanding when they sought help. And in certain cases, like Alfie here, this was the third vascular consultant I've seen. They have very limited understanding or interest in the condition. His story was about he kept on going to medical professionals, but it was essentially fobbed off and said, well, actually, everything's fine. You don't need anything else. It was that limited recognition of support to manage the condition, let alone the other things that come into play, let alone how that fed into public misconceptions. And in this case, Henry says, I can't walk in a straight line. That was due to the size of his limb and the gait changes. And I heard a couple of people behind me say, I must be drunk. Now, this is talking about a highly visible condition that's invisible from a public conception in terms of people misconstruing things, let alone not giving the case that there might be something else going on rather than inebriation. But also equally about finding support. In most cases, men, when they did seek support, didn't find it in the ways that they wanted, in terms of they were perhaps the only man in that particular support group, or the support group only discussed about examples such as breast cancer, which literally pushed the man out of the conversation in this instance, let alone other conditions. But some men did find support. And in this instance, the one by Luke, I was contacted by a support group because they wanted his involvement to raise the profile. It's fantastic, as there needs to be more positivity about lymphedema. What he wanted was to show the world that he had lymphedema, but there were positive elements about how to manage it, how to move on. Next slide, please. So the subtheme to this was about the constant reminder that came to men, the daily surprises, as they called it. Every morning I wake up with something different. It irritates me a little surprise every morning by Ryan. Now, you may say that lymphedema always fluctuates, but for men, the reason for the fluctuation also signified about the notion of control. If it wasn't down and managed as well am I controlling it? Because they've lost an element of control in their lives, let alone the support not being there about how to manage that change. And for some men who were fathers, it was about the family impact. My son said, because they were on a beach playing games, another kid came along, wanted to play and then wanted to race. That child said, his son said, my dad can't race. He's got a rubbish leg. I was embarrassed and annoyed with myself. Embarrassment of not being able to perform that act as a father in this instance, but annoyed with the simple fact of not, why am I annoyed with myself when I have a condition, but I can't talk about it, let alone show it? And that fed into the physical concerns about how dry skin can crack, causing lesions that could get infected, leading to cellulitis, which sets me back every time. It's that notion of that daily surprise, the impact, then about not managing it or having cracks that suddenly sets them back at the beginning. And it's that constant reminder of how things have changed. Next slide, please. And that's why, in that instance of control, they sought solace in routine, the daily management. Having to adjust my compression stocking throughout the day, I feel frustrated, but at least I can be active. That was Luke 34 years, is, by the way. Now, the reason for that is that enabled them to actually, as I say, gain that control, because what they wanted to become was the expert patient in a number of instances. I like to regard myself as an expert patient and feel it's my duty to manage my condition well. And that duty itself fed into their long-term perspective. In terms of my fear is that as I age, the condition will get harder to manage. So it's that cycle of trying to control and manage a condition that forever changes, to be an expert about those changes, but also thinking about the future and how will that affect me and the activities that I enjoy doing, because a number of them want to continue with the things they did from hiking, walking, exercise, whilst others retreated and pulled away from those activities that they once did. Next slide, please. And those aspects of the diaries fed into the interview findings around about support and masculinity. The reason for the part 1 about disruption is, in this particular analysis, they talk about parts of a story. Stories are never linear, they go back and forth. This is one way of structuring that story into a bit more of a linear side of things that we can tell. So part 1 was always about that disruption, the focal point. It came from nowhere, and I had a severe bout of cellulitis which hospitalised me. Chris, 50. Now, lymphedema in all the men that I spoke to came unknowingly. It was insidious. It crept up on them. It's only when those serendipitous discoveries came along, in terms of, I first saw symptoms when it was noticed by a friend of mine at a party. A number of men said, actually, either the cellulitis caused it to come into their awareness, or other people in a large majority noticed it more than them. I suppose it's that notion that we always give excuses for the reasons that we see things. Is it because I've had a long day, a hard day, I've been on my feet? Rather than thinking, is it something else? But that also does feed into the notion, do I have enough information to notice that difference, let alone being able to do something about it? But when men did seek help, and I always say this, in this instance, men did seek help, but they perhaps didn't quite get the support that they needed. In certain men, they had to prepare, and it was that preparation. I'd already done my Googling. I was adamant I was going to get a referral to the vascular team. Luke. Now, what I did notice was some of the younger men did a lot more research in terms of utilising technology, Googling, looking for things to go in prepared. Whereas the older men in these instances either relied on others. But I also have to take into account the fact that some of these men had a diagnosis 20 years ago and availability of these tools is limited. But what we are seeing is them will utilise IT technology to find more information. But when they did prepare and go there, of course, it led to differences of sometimes a lack of compassion, let alone limited support. In this one instance, when they did get a diagnosis, well, the fact is they were told you've got it for life. There's no way of getting rid of it. Learn to live with it. What do you do with that when you're told to learn to live with it, but you have neither the knowledge, the skills to be able to do that? And this is, unfortunately, the sad fact when we come around regarding support for men in this instances, but it also can relate to other diagnoses as well. Next slide, please. And this led to the journey that men took in part 2, pursuing a normal life. So some men, what they try to do in a large instances is try to pursue what they did before, but not always in the most healthiest of ways. In this instance, Ryan says, trying to live a normal life as a chef, I'd get wrecked. And when we talked about getting wrecked, we talked about the fact that in this instance, that person turned to alcohol and substances such as drugs, and that gave them the mental capacity to not think about their legs. But then that fed over a number of years about the gradual adaptation. It took me time to make things work. It's taken 11 years to get there. Not all men have reached that stage of acceptance. So with this side of things, it's a case of working through things with support, but noticing that actually during that journey, there's a sense of vulnerability. And in certain instances, I don't want to be seen as having a deficiency or a weakness. And sometimes that comes back to the fact that men, as a notion in society, not to club it all together, are meant to do and act in certain ways, in certain instances. To have a weakness is to show vulnerability. Vulnerability may not be accepted. It's about the way that we reframe this to say seeking help and support is potentially a source of strength. But that's why some people turn to their partners if they had them. So thankfully that I had my partner to keep me level-headed. I didn't know what I would have done without him. Now, partners were extremely important if they were there. They served as the emotional element that men turned to, that they could be open with. Whereas friends served as the instrumental side of things, the things that they could do, the actual actions perhaps. But not all men have partners. And so with that, not all men had friends that they were happy to be open with as well. So it's that notion of what do I do? So a number of men might pull back and conceal themselves from others and withdraw. So a number of men withdrew from sports and gym work that they once enjoyed. Next slide, please. There we go. And part 3 was I asked a specific question about masculinity. How do they view it? And what men said was about the embedded nature. My masculinity image is one I can't quite articulate because I've lived with it all my life. Now, a lot of men said that, but what they related to was about their masculinity lived through the acts that they did with their family, engaging in their community if they did, but also the physical elements about appearance and about being able to do things. But some men, what they showed about that gradual adaptation was about the reflection. My masculinity was affected when I had to put these stockings on. It was incredibly embarrassing. Now, it's the use of also words as well in this, stockings versus socks. And stockings themselves as a notion appear to be, for certain men, a feminization of their condition, rather than actually saying it's tailored to me. I can see myself in what I'm doing. But it's that notion of adjusting from suddenly being able to do things to suddenly having to wear things and explain things, but also hide things from people just in case they misinterpret what it is they're doing, and also say things. And this is why it led into concealment for a number of men, and not all men continue to conceal. Other men really fought against it and said, I'm not going to conceal it. But a lot of men said, I'm able to wear long pants, which are trousers, everywhere. So nobody says anything about my leg. Again, it's that notion of projecting a certain thing to society that says, I'm absolutely fine, there's nothing wrong with me, as much as they might be crying out for help and support. They don't know how to articulate that, and if they did, who do I turn to? Next slide, please. So the overall findings is about men seek information actively for answers in different configurations about their condition, and they might use IT research. Let's leverage that. If men want to seek information, let's give it to them. Let's make it easy for them. That led into the notion of masculine capital, about learning to manage, to help manage things, and a sense of masculinity through gaining expertise. Masculine capital is all about what men may be viewed as being, helping and supporting them maintain what they see as masculine. And that might be through mastery of the condition, of being able to control it. But it's about that notion about limited recognition, the lack of public awareness about lymphedema as a whole, but especially about men, and about this being taken seriously and understood by others, rather than being told in certain instances, you've got to just live with it. But also about partner support, how that may differ across the board, about how men may ask partners to help and support them through emotional or even physically helping them. In certain instances, some of my participants actually had to ask their partners to help them to put on that compression therapy, which again, they said was incredibly embarrassing to actually ask somebody to do that. Hence why there's no single approach. It's about engaging in that person and their relationships as to where they seek support. But it's recognizing there's a treatment burden that comes to play when men perceive lymphedema, about regarding the constant reminders that come to play around it, but also how that burden also enables them to be able to perform their normal activities, or at least perhaps engage in different activities. And it's all about that physical impact, about how all participants mentioned how lymphedema affected their strength and appearance, which I know is a bit of a contradiction in some of the research, because I say appearance is more perhaps emphasized by women than men. In this instance, men were concerned about their appearance and how that looked in trousers, etc., but also if they even wore shorts. And it's that ability to meet their own expectations, and that differs across the men. Next slide, please. So if we talk about practice implications around masculinity and support is about the redefining masculinity. It's not one in the same. It's about facilitating a more positive redefinition of masculinity. Seeking support is not perhaps seen as a weakness, it's seen as a strength. Engaging in peer support, here about enhancing that, is about connecting men to peer support groups that share experiences and reduce isolation. Now, in that sense, it's about noticing that when we redefine masculinity, we're saying, actually, when you speak to other men, which may be concerning or vulnerable, you're meeting others in a very similar position. And that way, that can be helpful to actually show how baselines have changed around what men seek in terms of what you're going through versus what I'm going through. What are the skills that can come to play? And that's about emphasizing skills mastery, about encouraging men to acquire skills to effectively self-manage. And that might be for the peer support, or it might be for the information we give. But it's also about the terminology we use. Using perhaps gender-neutral terms when we describe things, such as avoiding the notion of stockings, can be perceived as feminizing the condition. But we all fall into terminology, not with the intention of causing harm or offence. It's just sometimes the words that we use. It's just about reflecting on that and using words that perhaps emphasize or change things in a more supportive way. And next slide, please. And this is my final slide, just to say thank you very much for joining me for this webinar and listening to me. I really appreciate it and sharing the voices of men with you today. Thank you again.
Gary, I cannot thank you enough for such an amazing presentation. And don't go anywhere, guys, because we're following on from Gary's presentation, and we're going to introduce you to Matt. Gary, that was amazing. I think it really helped me to understand thinking about that loss of role more, that letting people down, that real strength in masculinity, and around that lymphedema being a real weakness there. And also about that kind of stiff upper lip, for want of a better word, trying to be coping, be able to sort of present to the outside world, you know, I'm okay. We've got one question in the chat, which I'm going to come on to in a little while, but I also wanted to just reflect on that terminology as well. And I had to reflect on my own practice. You know, I talk about stockings, hosiery, which again, you know, would be a word that my granddad would have known as being hosiery was stockings and tights, lace top, you know, thigh grip top. They're all things that we associate. Sheer fabrics, you know, again, thinking about that. So it's really made me reflect on some of those things. So thank you.